Pam and Gary on News Talk 1480 WHBC.
Oh my goodness, I'm such a huge fan.
News Talk 1480 WHBC with Pam and Gary. All right, well, we're not forgetting the legacy of Robin Williams at all, but now what's happening is we are truly digging deeper into his suicide. And the question now, did the diagnosis of Parkinson's disease help sink Williams further into depression? There has been friends of his, Rob Schneider, yesterday came out and tweeted saying that he thought it might have been the new mixture of medicines, Parkinson's with his previous, that might have put him over the top. And I know he's not a medical doctor, but a lot of Hollywood friends are saying he was on some new meds.
Well, and that's something to think about as well. But right now on our WHBC Newsline, we bring in Dr. Al Johnson. Good morning, Dr. Johnson.
Good morning.
We're looking at this story with Robin Williams, and there obviously always in such cases of suicide, there's a lot of speculation, but we kind of want to relate the fact that news came out that he had been diagnosed with Parkinson's disease. In your mind, do you think that that could have played a part in the role of his suicide?
Well, it sure could. 50% of patients with Parkinson's have depression, and of course we know Parkinson's affect the brain, and the brain's involved in depression from the brain hormone aspect. So that's definitely a possibility. And then just the psychological factor of knowing what you got and knowing the process of it, as he was intimately involved in Parkinson's funding and helping raise money for research. He was well aware that there's no cure, treat the symptoms. Some people respond well, and some people have a more progressive disease process.
Does it also compound to the fact that he really masked his depression publicly? He was just the face of happiness, funny, and even when talking about his depression, he was joking about it. I mean, I know that's his natural way of dealing things. Does that compound it? Does he get deeper in depression?
Well, I'm sure that happens because he's very good at portraying an attitude just the opposite of depression. But that happens in a lot of people that are depressed. They may have the maybe depressive type where they have downs and then they're really high, or they just overcompensate with a brilliant mind like his, and then you really don't know what the deep, dark demons are behind it. And of course, he'd been treated for his addiction and apparently just fairly recently come out of some rehab for we don't know what at this point. But all those factors definitely play a role in what his mindset was and how bad he was feeling.
What about some of those reports from some of his Hollywood friends that said that, and I don't even think they know whether he was being treated with any Parkinson's disease medicines, mixing with meds that he's already on. I mean, can that happen? I guess we're just speculating, but let's just say that in theory he was taking meds for this. But shouldn't the doctors know what medicines shouldn't be mixed with other meds?
Not exactly, because everybody handles medicines in a different fashion, depending upon their genetic variabilities on how they metabolize medicines, and that determines what adverse effects you may have. So, particularly in a bunch of the psychological type medicines, you're trying something to treat some symptoms and see what happens. So you have to watch that person quite carefully. There are some out-of-the-box kind of thinking now. There's a urine test that has been adapted from Germany that looks at some of the brain hormones like serotonin, epinephrine, norepinephrine that can help be a guide. And then sometimes in treatment, we have to think outside the box also. And Dr. Perlmutter, a neurologist, wrote a book about brain recovery. And I treat patients that have Parkinson's, and we use some nutrients to help their brain hormones function better, and then we use hyperbaric to get oxygen and heal the brain.
Well, and I guess that a lot of folks say that Parkinson's is something that brings on depression anyway, and that this may have just added to the whole thing for him.
Exactly. 50% of the Parkinson's patients are depressed as part of their disease process. So, exactly. It's a matter of recognizing it, family members being very supportive, keeping a close watch on these people. report any adverse effects that are observed quickly, because the end result can be quite devastating.
Add to it that he had heart procedures too, which they also say a side effect can be depression afterwards.
Well, exactly. During heart surgery, sometimes you get decreased circulation to the brain. The brain reacts in different manners, and it causes brain changes. Exactly.
All right, Dr. Al Johnson, we appreciate your time this morning, sir.
Oh, you're welcome. Hope it's been helpful to the listeners to understand better what can go on.